Physical therapists across America have one secret weapon, one product that sits in every single therapy clinic from New York to Los Angeles, one gel that professionals reach for before almost anything else when a patient walks in with muscle pain, joint pain, sports injuries, or post-surgical soreness. It is not a prescription. You do not need a doctor's note. You can buy it at Walmart right now for under $15, and millions of Americans walk right past it every single day without understanding what it actually does or why physical therapists trust it more than almost anything else on the shelf. Today, I am going to tell you exactly what this product is. But first, I am going to show you exactly how it works in your nervous system, exactly why it delivers the results it does, and exactly who it is perfect for. Because once you understand the science, the name reveal at the end of this breakdown is going to make complete and perfect sense. And in about 4 minutes from right now, I am going to reveal the name of the #1 physical therapy pain relief gel in America, the one that has been sitting on pharmacy shelves for decades, that costs less than $20 and that delivers genuine clinically validated pain relief through a specific neurological cooling mechanism that most people have never had properly explained to them. But I'm not going to tell you the name yet, because the name means nothing without the science. And once I walk you through exactly how this gel works, exactly what its active ingredient does to your pain receptors, exactly which conditions it helps most, and exactly how to use it correctly for maximum results, you are going to understand why this particular product has earned the trust of physical therapists, sports medicine doctors, and millions of everyday Americans for over 30 years. Stay with me, the reveal is coming, and it is worth the wait. And real quick, right now, before we go any further, if you know someone who is dealing with muscle pain, joint pain, sports injuries, or chronic soreness and is spending money on products that are not giving them real results, pause this video and send it to them right now. Because what we are about to cover could save them time, money, and months of unnecessary suffering. And if you are not subscribed yet, hit that subscribe button right now. Every single week, we bring you honest, research-backed health and pain relief information that your doctor or physical therapist probably never had time to fully explain. This community grows every single week, and I do not want you to miss a single video. Now let us get completely into the science, because the name reveal is coming and everything will make perfect sense once you understand how this product actually works. Let us start with the active ingredient, because this is the heart of everything. The gel I'm about to reveal uses one primary active ingredient that has been used medicinally for well over 100 years. This ingredient is a naturally occurring compound found in mint plants, particularly peppermint and cornmint, and it has been studied more extensively than almost any other topical pain relief compound in existence. It works through a specific and fascinating neurological mechanism that is completely different from how most other pain relief products work. And understanding this mechanism is what will tell you exactly why this gel works so well for certain types of pain, and help you understand precisely how to use it for maximum benefit. This active ingredient works by binding to a specific protein receptor in your skin called TRPM8, which stands for Transient Receptor Potential Melastatin 8. TRPM8 is your body's primary cold-sensing receptor. Under normal circumstances, it activates when your skin is exposed to genuinely cold temperatures, below approximately 26 degrees Celsius, sending a signal to your brain that the area is cold. When this active ingredient binds to TRPM8, it mimics the effect of cold temperature, activating the receptor and sending a strong, clear, cooling signal to your brain, even though the temperature of your skin has not actually changed at all. Your brain receives this cooling signal, and it competes directly with the pain signals that are also traveling from the same area to your brain. This competition, where the strong cooling signal temporarily overwhelms and overrides the pain signal in your nervous system, is called the gate control theory of pain. The cooling signal essentially closes the gate on the pain signal, reducing how much pain your brain actually perceives. The result is that fast, distinctive, deeply cooling sensation that spreads across the skin within seconds of application, and that provides genuine, immediate relief from the pain signals your body was generating. But this active ingredient does more than just create a competing cold sensation. At the cellular level, it also activates a process called counter-irritation through a secondary mechanism involving the release of endorphins, your body's natural pain-relieving compounds, from the nerve endings in the area of application. When TRPM8 receptors are activated by this ingredient, They trigger a cascade of neurochemical responses that include the release of these endorphins locally, providing an additional layer of pain relief that goes beyond the simple gate control competition between cold and pain signals. This is why the relief from this gel often feels more profound and more sustained than a simple cold pack applied to the same area, because the neurochemical endorphin response adds a biological pain-relieving component on top of the sensory competition mechanism. There is a third mechanism that makes this ingredient particularly valuable for musculoskeletal pain specifically, and that is its effect on local circulation. Application of this compound to the skin produces an initial cooling vasoconstriction, a narrowing of the small blood vessels near the surface, followed by a secondary vasodilation, a widening and opening of the blood vessels in the deeper tissue layers beneath the skin. This biphasic vascular response increases blood flow to the muscles and connective tissues beneath the application site, delivering more oxygen, more nutrients, and more of the immune cells responsible for clearing inflammatory compounds from the tissue. For muscle soreness, post-exercise recovery, and acute sports injuries specifically, this improved circulation is a critically important component of the healing process. And it is one of the reasons this gel is so particularly valued in sports medicine and physical therapy settings where tissue recovery speed matters enormously. Now let us talk about the clinical research, because this ingredient and the products that use it have been studied extensively and the evidence is genuinely compelling. A randomized controlled trial published in the Journal of Athletic Training, one of the most respected journals in sports medicine, found that topical application of this compound at 4% concentration produced significant reductions in muscle pain and perceived exertion during exercise compared to placebo. Another study published in the Clinical Journal of Pain found that patients with chronic musculoskeletal pain who used this compound topically reported significantly greater pain reduction and improved functional mobility compared to those using a placebo gel. And a comprehensive review published in the European Journal of Pain analyzed multiple studies on this compound for acute and chronic pain conditions and concluded that it provides clinically meaningful pain relief for musculoskeletal conditions with an excellent safety profile and minimal systemic absorption, making it particularly suitable for regular use in adults of all ages. The conditions for which this compound has the strongest clinical evidence include acute muscle soreness and delayed onset muscle soreness following exercise, which is why it is so popular among athletes and in sports medicine. Joint pain and stiffness, particularly in the knees, shoulders, elbows, and hands, where it reduces perceived pain and improves range of motion. Post-surgical and post-injury soft tissue pain, where it provides localized relief without systemic side effects. Neck and shoulder tension and muscle tightness, where its combination of cooling sensation and improved circulation delivers particularly rapid and satisfying relief. And general musculoskeletal aching from overuse, repetitive strain, and the everyday wear and tear that accumulates in active bodies over time. The correct application technique matters significantly for getting the best results from this compound, and most people apply it incorrectly in ways that reduce its effectiveness. Apply a generous amount to the entire affected area, not just the point of maximum pain, because the neurological gate control mechanism works best when the cooling signal covers a broad enough area to effectively compete with the pain signal. Massage it in gently with circular movements for approximately 60 to 90 seconds. This mechanical massage action enhances both the penetration of the compound into the deeper tissue layers and the circulatory response that improves local blood flow. Do not cover the application area with tight clothing or bandaging immediately after application. The evaporation of the gel from the skin surface is part of the cooling mechanism, and covering it reduces the sensory effect. And apply it 2 to 4 times daily for chronic conditions. Consistency of application is important because the endorphin release and circulatory benefits build cumulatively with regular use. Now, 4 minutes in, it is time for the reveal you have been waiting for. The product is Biofreeze Pain Relief Gel. With its active ingredient menthol at 4% concentration, the iconic green gel that is used in more physical therapy clinics across America than almost any other topical pain product. Available right now at Walmart, CVS, Walgreens, Amazon, and virtually every major pharmacy and retail store across the country for under $15 to $20 depending on the size you choose. Biofreeze has been trusted by physical therapists, athletic trainers, sports medicine physicians, and millions of everyday Americans for over 3 decades. And now you understand exactly why. Not because of the marketing, not because of the brand name, but because of the specific clinically validated neurological and physiological mechanisms of its 4% menthol active ingredient that we just spent the last 4 minutes walking through together. Biofreeze comes in multiple forms: the classic gel, a roll-on applicator, a spray, and a cream, each designed for different application preferences and different areas of the body. The gel provides the most intense cooling sensation and is best for large muscle groups and broad areas of pain. The roll-on is the most hygienic and most convenient for self-application to hard-to-reach areas like the upper back, shoulders, and knees. The spray is ideal for sensitive skin or for covering large areas quickly after sports or exercise, and the cream version provides a slightly longer lasting effect with a less intense initial cooling sensation, which some people prefer for bedtime application. Now, I want to stop and share a story that brings everything we have discussed to life in the most real and personal way possible. Aris is a 58-year-old high school basketball coach from Columbus, Ohio. He has been coaching for over 25 years, and his body, particularly his knees, his shoulders, and his lower legs, has accumulated the wear and tear of a lifetime of athletic activity. About 3 years ago, Aris began experiencing chronic knee pain and shoulder soreness that made his coaching physically uncomfortable, and that was beginning to affect his sleep and his daily quality of life. He had tried several over-the-counter pain creams and gels, some menthol-based, some with salicylates, some marketed specifically for joint pain, with mixed and largely disappointing results. He was spending money on products that gave him maybe 20 minutes of mild relief before the aching and soreness returned in full force. It was one of his athletes, a 17-year-old varsity player who had been using Biofreeze recommended by the school's athletic trainer, who suggested Aris try it. Aris was skeptical. He had seen Biofreeze on pharmacy shelves for years and assumed it was essentially the same as every other menthol product he had tried. But his athlete described something that caught his attention. The relief was deeper and more sustained than regular menthol products, and the athletic trainer had specifically explained the science of how the 4% menthol concentration activated cold receptors in a way that lower concentration products simply could not match. Aris picked up a tube of Biofreeze gel at his local CVS on the way home from practice and applied it to both knees that evening following the correct application technique: generous coverage, circular massage for 90 seconds, left uncovered to allow full evaporation. Within 5 minutes, the cooling sensation had spread across both knees in a way that felt genuinely different from anything he had used before. Not just a surface tingling, a deeper, more penetrating cooling that seemed to reach into the joint itself. The relief lasted nearly 2 hours on that first application, significantly longer than anything he had experienced with other products. He applied it again before bed, and for the first time in weeks, woke up the following morning without the stiff, aching knee pain that had been greeting him every single day. Aris incorporated Biofreeze into his daily routine, applying it to his knees before practice, to his shoulder after practice, and to both areas before bed. Within 2 weeks, his chronic knee and shoulder soreness had reduced significantly enough that he was able to coach full practice sessions without the constant awareness of pain that had become his background companion. He told the school athletic trainer, who had been recommending Biofreeze to student athletes for years, that he wished someone had pointed him toward this product years earlier and explained the science behind why it worked. The athletic trainer laughed and said, "Most people just grab whatever is on sale without understanding what they are actually buying." Aris now keeps Biofreeze in his gym bag, his car, his desk, and his bathroom cabinet, and he recommends it by name to every parent, teacher, and colleague who mentions muscle or joint pain to him. So, now let us talk about how to get the best possible results from Biofreeze for your specific situation. For acute injuries, new muscle strains, joint sprains, post-exercise soreness, apply Biofreeze gel immediately after the injury or immediately post-exercise. Use it 3 to 4 times daily for the first 48 to 72 hours, and combine it with rest and gentle movement to maximize the circulation-enhancing benefits of the menthol. For chronic conditions, ongoing joint pain, persistent muscle tension, recurring soreness from repetitive activities, consistency is the key. Apply twice daily, once in the morning to start your day with reduced pain and improved mobility, and once in the evening to address the inflammation and soreness that accumulates throughout the day and to improve your sleep quality by reducing nighttime pain. For post-surgical recovery, always consult your surgeon before applying any topical product near or over a surgical site. For nerve-related pain conditions, Biofreeze may provide some temporary relief through the gate control mechanism, but it is important to understand that the underlying nerve cause requires separate evaluation and treatment. And for seniors over 60, Biofreeze is an excellent choice for daily musculoskeletal pain management because it provides genuine relief without systemic absorption and without the stomach, kidney, and cardiovascular risks associated with oral anti-inflammatory medications taken long-term. A practical tip that significantly enhances the effectiveness of Biofreeze, particularly for joint pain, is to combine it with gentle range of motion exercises immediately after application while the cooling and endorphin response is active. The combination of the neurological pain relief from the menthol and the gentle movement that improves joint lubrication and circulation produces results that are meaningfully better than either the gel or the movement alone. Physical therapists use this exact approach in their clinics, applying Biofreeze and then immediately guiding patients through gentle joint mobility work while the product is active. And it is one of the primary reasons Biofreeze has maintained its dominant position in physical therapy settings for so many years. The bottom line is this: Biofreeze Pain Relief Gel with 4% menthol is not just another product on the pharmacy shelf. It is a clinically validated, professionally trusted, and mechanistically well understood pain relief tool that, when used correctly, generous application, proper massage technique, consistent daily use, combined with movement, delivers genuine and meaningful relief for muscle soreness, joint pain, sports injuries, and the everyday musculoskeletal aching that affects millions of Americans every single day. Aris found this out from a 17-year-old athlete. Now you know everything that Aris knows, and more. Go pick up a tube. Use it correctly, and feel the difference that understanding the science makes. Now, before you go, drop a comment right now and tell me your age and the city you are watching from. And tell me, have you ever used Biofreeze before? Did you know how the menthol actually worked in your nervous system? Are you going to try the correct application technique after watching this? I want to hear from you. I read every single comment personally, and this community is the reason this channel exists. And if this video gave you something genuinely valuable, real knowledge about a real product that can make a real difference in your daily pain levels, please share it right now with someone who is dealing with muscle or joint pain and spending money on products that are not working. Hit that subscribe button, turn on the notification bell, and I will see you in the next video. Use the right product, use it correctly, and take real control of your pain. This video is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment of any kind. The information presented reflects publicly available research and clinical literature as of 2026. Biofreeze is a commercially available over-the-counter product. This video contains no paid promotion or brand sponsorship of any kind. The patient story featuring Aris is for illustrative purposes only. Individual results will always vary. Biofreeze and menthol-based products may not be suitable for everyone. Do not apply to broken, irritated, or sensitive skin. Do not use near the eyes or mucous membranes, and keep out of reach of children. Always read complete product label instructions before use. Consult your physician or physical therapist before using any topical pain product if you are managing serious health conditions, taking prescription medications, or recovering from surgery. The creator of this channel is not a licensed medical professional. No statements in this video have been evaluated or approved by the FDA. Nothing in this video is intended to diagnose, treat, cure, or prevent any disease. Never delay seeking professional medical advice because of content you have watched online. Viewer discretion is advised.